We've had in February a predominance of men who've been affected more than women. So for the month of February, we've had a total of 157.5 cases per 100,000 population that are men, and 113.6 cases per 100,000 population that are women. And perhaps this reflects the work environments that we've seen that have been more affected in February with regards to our outbreaks. We've, in the past 24 hours, had 71 new cases. So this is a high number. Not the highest we've ever had, but it is a very high number. They include 66 cases that are sporadic, 2 that are from institutional outbreaks, 3 that are part of workplace outbreaks. The latter 3 in workplace outbreaks are people who live out of jurisdiction, so they're not on our tally on our website. 29 of these are male, 42 are female. Ages range from under 10 to in their 80s. Most of them are in their 30s. In terms of variants of concern, 20 of them are screen positive, and 1 of them has been confirmed to be the B117 variant. All of them live in Simcoe County, except for those that were out of jurisdiction. And 1 was acquired in the community acquired, which means that we don't know how they acquired it, 4 from close contacts, 5 from outbreaks, and 61 under investigation. 67 of those are in isolation and 4 are recovered. So the vast majority of our new cases have been in South Simcoe, so in Barrie, Bradford, West Gwillimbury, New Tecumseh, and Innisfil. This is the pattern that we've had throughout the pandemic. And in terms of the incidence of infections over the week per municipality, Bradford, West Gwillimbury has the highest incidence per capita. So 102 cases per 100,000 population for the week. Innisfil, 88 cases per 100,000 population for the week. And Barrie, 86 cases per 100,000 for the week. And Penetanguishene, 83 cases per 100,000 for the week. In Muskoka, Huntsville has the highest incidence at 42 cases per 100,000 population for the week. And in the month of March, Huntsville has had 17 cases, which is the highest number in any month for them since the start of the pandemic. We've had a large number of cases that have occurred and had impact on educational settings. So a total of 97 cases since February the 8th, with the opening of schools, have impacted on schools. We've had a total of 5 outbreaks in schools. So the rest of these are cases that haven't resulted in transmission. So there've been exposures and people requiring isolation and follow-up, but most of them have not resulted in transmission at the schools. Most of them have been in elementary schools. Just under a quarter of them have been in secondary schools. And we've had 7 cases in childcare settings as well, and 1 childcare setting with an outbreak. So with regards to our variants of concern, we now have a cumulative total of 850, which is up from 682 variant cases a week ago. And they break down as follows. 252 of them are the B117 variant, which is up from 225 a week ago, and 590 are screen positive as variants awaiting determination as to which variant, up from 455 a week ago. We also have 7 cases of the P1 variant. This is a variant that was originally identified in Brazil. And this is up from 2 a week ago. They are a cluster that are connected with each other and with a work environment out of our jurisdiction. And we have our first case of the B1351 variant, which is a variant that was first identified in South Africa. And this is a single case that has occurred in Simcoe County. In terms of our variants and where they're located in our district, 96% of them have been located in Simcoe County, and 4% of them have been located in the District of Muskoka. A total of 32 of these cases, up from 24 located in the District of Muskoka, as opposed to 818 in Simcoe County, up from 658 a week ago. We do have an upward trend in the percentage of our cases that are of our COVID cases that are variants. So in the week of March the 7th, 73% of all of our COVID cases were variants of concern, up from 54% the week of February the 7th. So over the month period, significant jump in the proportion of our cases that are variants of concern. And I think we're really getting to the point now where we're considering variants of concern to be the dominant element of our COVID cases. And thinking in terms of now, when we're talking about COVID, we're essentially talking about variants of concern in Simcoe, Muskoka. The majority of our cases have been sporadic cases too, more recently. So in January, the majority of them were associated with the large outbreaks that we had of variants of concern back on January the 17th. 69% were related to outbreaks. And the week of March the 7th, 89% of them are sporadic, unrelated to outbreaks. We have 4 active outbreaks of variants of concern in Simcoe County. 3 of them are in workplaces, food premise, retail, and a finance and insurance location, and 1 in an educational setting. And the numbers of our outbreaks of variants of concern have come down in the past couple of weeks. So February the 21st, we had 6 new variants of concern declared. The week of February the 28th, we had 4. In the week of March the 7th, we were down to 1. So far this week, we're down to 1 variant of concern. We do note that the total number of cases of variants of concern is back up again in the past week. So the week of March the 7th, we had 151 cases. The week before that was 111, and the week before that was 121. So a dip and then a rise again in the total number of cases of variants of concern. And if we look at all of our outbreaks, they are as follows. This is outbreaks that include those that are variants of concern and those that aren't. We now have 11 outbreaks that are active, down from 18 a week ago. And 4 of these active outbreaks that are ongoing are variants of concern. So presently we have 2 institutional outbreaks, down from 6 a week ago. So the following outbreaks are declared over Leacock Care Long-Term Care Facility, Grove Park, Barrie View Retirement Home, and Mill Creek. We have no congregate setting outbreaks. We have 6 workplace outbreaks, which is unchanged, though we've had some end and some begin over the past week. So 4 new outbreaks, 1 a retail outbreak in Muskoka, an accommodation in Simcoe County, a manufacturing facility in Simcoe County, a retail location in Simcoe County. We have as well, I beg your pardon, there's actually a 5th new outbreak, and that's at a food premise in Simcoe County. We have 5 that are declared over, 4 in manufacturing, all in Simcoe County, and 1 retail location in Simcoe County. We have no community setting outbreaks. So 2 were declared over in the past week. One ambulatory healthcare service setting in Simcoe County and a personal service setting in Simcoe County. And we have 3 educational settings in outbreak, down from 4 a week ago. So 2 new schools, one Andrew Hunter Elementary School in Barrie and Our Lady of Grace Elementary School in Angus. And neither of these have been shown to be VOC outbreaks. We have an existing outbreak that's unchanged, Holy Trinity Catholic High School in Bradford, which is a VOC outbreak, and we have a child care center in Simcoe County, which is declared over, as well as St. Teresa's Catholic High School declared over, and Maple Grove Public School in Barrie declared over. In terms of our vaccinations, at this point, we've administered over 57,000 doses, up over 7,000 in the last week. This includes 16,000 individuals who received both of their doses, so they're fully immunized. And last week, we started administering through family health practices AstraZeneca as a vaccine for people between the ages of 60 and 64. So that's been distributed to those family practices, and so far we're aware of 500 of the doses that have been administered. If you look at our website now, we've got new information about immunizations. It provides more of a breakdown of the locations in which individuals, well, basically priority individuals, people from priority groups, and what the coverage is to date, how much has been administered, how many doses, how many received, or what percentage of them have received their first dose and their second dose. So there are certainly some that we've been working with for a long time now, so from early on back in December or into January. And among those groups, we have a very high immunization rate for first and second doses. So residents in long-term care facilities and retirement homes are well above 90% for their first dose. And we are working to get them their second doses as well. And we've also have essential caregivers in retirement homes where 85% of them have received their first dose, and 65% of hospital staff have received their first dose. What's more recent for us is what we're calling other healthcare workers. So these are the very high or high priority healthcare workers by the province's framework, and they include basically healthcare workers in the community who provide care directly to COVID positive individuals, or are very likely to do so. And so far, 39% of them have received their first dose. And we're now working to provide immunization to people residing in congregate settings, providing service to seniors, and 25% of them have received their first dose. We have another group called other priority groups. We don't have a denominator for that group as yet, so we can't talk about a percentage coverage, but over 1,000 of those individuals have received immunization to date. In terms of our dashboard, this is the health unit's dashboard, not the province's framework. We remain in red status because of viral spread. Laboratory testing, we have ourselves down as yellow status because of a one-day turnaround time. A goal of 60%, we're at 55%. And we have a percent positivity that's gone up to 2.2%, up from 1.5%. Percent positivity is a measure of how much COVID is transmitting in the community versus how much testing are we doing. And the higher the number, the more worrisome the figure would be. So not good if it goes up. Our health system capacity is at yellow status in that we are at target with regards to acute bed capacity, but not quite as good as we would like to be, therefore yellow. And our public health system capacity is at red because our difficulty in being able to get to all of our cases and their contacts within a 24-hour period. The percent of new cases that we reach within 1 day is 83%, and our goal is 90%. The provincial dashboard is also up on our website, so people can have a look and see, how our indicators fare with the province's dashboard. But with the numbers that we have now, we definitely are in red, which is control status, which is what the province has us designated at. We, in terms of our trend, are up to a weekly incidence of 49.5 cases per 100,000 population per week, which is significantly elevated over a week ago, as I'd said earlier, at 35.7 cases per 100,000 population per week. The province, too, is going up. So they are now up to 63.8 cases per 100,000 population, compared with last week at 53.3 cases per 100,000 population. So to me, the trend is of concern, I would say, both provincially and locally. Our reproductive number is 1.1. So anything above 1 means that you've got a growth in the pandemic locally, and that's up from last week, which was 1.0. The province's rate is 1.1 and unchanged from a week ago. So I think I would reflect that the province has us in red designation. Our numbers support us being in red designation. We have gone up a significant amount in the past week. Our variants of concern continue to trend in the direction of dominating among all of our COVID cases, as we'd anticipated they would. We very much need to maintain our control measures in our daily lives. So people are being very careful as they consider going out really for essential purposes. And when you do go out, keep the physical distance of 2 meters from other people, and wear a mask when in indoor public places or workplaces, hand hygiene, self-monitoring. If you develop symptoms, seek assessment and maintain yourself in isolation. I have an order out to the community that I spoke to a week ago that requires people to self-isolate if they've been in contact with a case, but also to self-isolate if you've been in contact with a potential case. So somebody with symptoms of COVID-19 really need to self-isolate until they've been assessed and determined whether or not they have COVID-19. So it's very important for us to maintain all of that, for employers to maintain everything that I've required in my letter of instruction about screening of employees, and to maintain the work environment so that it's safe from an infection prevention control perspective, and allowing for the physical distancing, requiring it and enabling it in the work environment, and face coverings, and excluding employees who are symptomatic or have had high-risk contact with cases or potential cases. All of that's really critical for us to maintain control of the pandemic here in Simcoe, Muskoka. We have a great opportunity right now with immunization to be able to proceed with vaccinating the population. We've made an excellent start in protecting those most vulnerable in our long-term care facilities, so that our outbreaks in the long-term care facilities and retirement homes are way down, and mortality, though it continues, is greatly reduced compared with the past. But we need to proceed with immunizing the entire adult population, everybody who's eligible. We need to proceed with making it available to people over the weeks and months to come, working through the priority groups, that the province has provided in sequence. So all of that's really important. And we're at a point now where we want to get ahead of the pandemic and not have it swell into another wave while we achieve protection for everybody with the immunization and bring us to a much better place late in the spring and into the summer. That's the great opportunity for us to pursue. So yesterday, the province launched its vaccination booking system. As a health unit, we've had a booking system for quite a while now, and have therefore been able to book people to attend our clinics that are in the priority groups. But as of yesterday, the province has launched its own website and phone-based system. And we have aligned with that and are supporting that rather than keeping our own system going. But it's a little bit complicated. There were some glitches yesterday that I need to acknowledge. One was that some of our clinics were not initially uploaded into the province's system. Well, we don't know why, but they weren't yesterday morning and needed to be uploaded later in the day. So some people had to attempt to rebook again to get into our system in order to get into our clinics. And apparently some people were erroneously booked for a clinic that didn't exist today in Bracebridge. So some 10 people had a booking for a clinic that wasn't in existence. So we had our staff to meet with those people and rebook them for a clinic on Sunday instead. So I do apologize for that, for those people that are affected by that, though it wasn't actually our doing as a health unit. We're certainly fully committed to doing all that we can to making these systems work. So right now, people who are 80 and older can book on the province's system directly online or by phone. And from that, they will get a booking for a clinic in Simcoe, Muskoka. And as for others who are priority to receive immunization at this time, those who are the very high priority or high priority healthcare workers, according to the province's framework, as well as the adult Indigenous population, we are working to allow them to be put on a priority list that we submit to the province, or working with the leadership of the Indigenous community to have clinics for them to be immunized. And so people can go to our website. Those who fall into those priority groups, they can go to our website in order to pre-register and get onto our list that we then supply to the province, and then the province will reach out to people on that list in order to book in their system our clinics, to be able to enter to attend to our clinics. We have 3 vaccine types now that we're working with in Simcoe, Muskoka. So we've had Pfizer vaccine from the very beginning in December, and we're expecting to have a large increase in the volume of that vaccine starting next week, 2.5-fold increase. So that will increase our capacity to be able to see more people in our clinics, which is a very good thing. We, as of the weekend, received our first shipment of the Moderna vaccine, and we're using this vaccine because it's easier to handle for our mobile outreach clinics that we're taking to congregate settings for seniors. We also are participating in a pilot study for the provision of AstraZeneca vaccine through primary care clinics, family health teams, to individuals 60 to 64 years of age, people born between the years 1957 and 1961. And so we are providing that vaccine. On the weekend, we provided that vaccine to our 9 family health teams throughout Simcoe, Muskoka, in order to enable them to be able to contact their patients who fall into age range to book them to receive the vaccine. So I'm asking people not to contact their family practice, but to allow family practices to identify and contact people who would fall into those categories. And we expect that we'll continue to receive that vaccine in the future, but we do not know the amount or the frequency of that at this time. Also, our Associate Medical Officer of Health, Dr. Colin Lee, will be participating in a panel presentation called Your Health, COVID-19 Vaccination Saving Lives. This will be on March the 25th, Thursday at 7:30 p.m. It'll be provided via Rogers Cable Television and also live streamed on the internet. And we will have a link on our website if you wish to attend that. I would like to reflect that some concerns have been raised to me from some residents in Muskoka about the availability of vaccination clinics in their communities. And so I've released a letter to the citizens, those who work in Muskoka, those who live in Muskoka, those who attend healthcare in Muskoka on this issue, basically stating our commitment to making vaccination available equitably throughout all of our territory to the very best of our ability, based on our resources, the personnel that we can bring together as an agency with other community partners, and based on the supply of vaccine and following the province's priority groups in sequence. So far in Muskoka, we have 2 permanent vaccination clinics, one in Huntsville and the other in Bracebridge. And we will be providing pop-up clinics in other communities in Muskoka and also in Simcoe as well. We are also providing vaccine to some family physicians, family practices. The AstraZeneca vaccine I've already cited, but we are looking at the potential to provide some Moderna vaccine as well. And we certainly be looking to those communities that don't have our clinics as a priority for this. I do ask once again that people not contact their family physicians about this, but instead allow them to identify who they would approach in the priority groups, and that they would be doing so in keeping with the timing of provision of vaccine. And also transportation for people to be able to get to the locations of the clinics is important as well. And in Muskoka, the district has partnered with Hammond Transportation Limited in order to provide a busing service from people's homes to the 2 clinics in order to enable them to be able to get vaccinated. And we will, this is a free service, and we will, as an agency, continue to communicate on an ongoing basis about people's opportunities to get immunized throughout all of Muskoka and Simcoe. Just as information for people, today we have a clinic running in Alliston and Huntsville. For those who've got booked appointments, please do not go to clinics if you don't have an appointment. This is by appointment only in order to manage priority groups and the demands, and in order to avoid congregations that could lead to transmission of COVID-19, to avoid the crowding. If in doubt, contact us for more information on our website or by phone. We are also increasing our phone capacity. We've been challenged on that, and so we're establishing additional lines to help us manage the flow. And I'd also like to acknowledge the support of some of our municipalities in managing our phone demand as well. I've already indicated that we have additional information on our website right now with regards to who's received immunization to date and how much immunization. So certainly encourage people to have a look at that. We are doing a follow-up local impact survey of citizens in Simcoe, Muskoka, It would invite people to participate in that survey, to have a look on our website about how to do so. We had a similar survey in November, and the results of that survey will be released in April. But it's very helpful to us to have 2 points in time in which we are getting information back from people about the impact of the pandemic on their lives, and about our services as a health unit, about our response. So St. Patrick's Day is coming, and this is a reminder for people to please abide by gathering limits, by the recommendation that people stay at home except for essential purposes, and to avoid close encounters with other people, maintaining the physical distancing and mask use. We've seen with previous holidays, such as Thanksgiving and Christmas, a measurable rise in the rate of COVID-19 as a result. And if we're not very careful, we could see the same thing with this event. So at this point, I shall walk through the questions submitted by the media. We are hearing different stories about people in the 60 to 64 age group getting the AstraZeneca vaccine. How many doctors or family health teams in Simcoe, Muskoka are in the pilot program? Do you need to proactively inquire with the family health team and family doctor, or will they call the patients? We contacted all 9 of our family health teams in Simcoe, Muskoka, as soon as we'd heard that we were participating in this pilot, and were able to provide them with a vaccine last Friday. And we ask that you not contact your family practice, your family physician, that they will identify the people who would best benefit from the vaccine, that would fall in the priority group for this vaccine of 60 to 64 years of age, in order to book them for a vaccine. So please don't reach out to them. They'll reach out to those who they identify as being priority to receive the vaccine. There are lots of comments on social media saying there's a lot of wasted vaccine at day's end at clinics because of no-shows. How much wastage is there? What is being done to ensure all vaccine is used at each clinic? So we have no waste of vaccine. We very carefully monitor the amount of vaccine that we're using, and we have a backup list so you can contact people to have them come in order to receive vaccine. Very proactive about this, and essentially we have no waste in vaccine. How do the P1 and the B135 South African strains differ from the UK variant? And are there any particular concerns related to each? So we have 3 variants of concern at this point in time. And we have cases of all 3 different types here in Simcoe, Muskoka. All of them are deemed to be more transmissible, that you can contract it more easily. We have more information about the B117 variant than the other 2 variants. And the B117 variant may very well be more severe in its impact as well as contagious. The other 2 variants, we note that they're more contagious. It's not clear if they're more severe. And there's some concern that the B135 variant might have some degree of resistance against the AstraZeneca vaccine. There's still, a significant response to that vaccine from that variant, but some research has demonstrated that it's reduced. So the increased transmissibility of these variants is of concern. The potential for at least one of them to be more severe is of concern. And we certainly need to continue to monitor the impact of these variants on responsiveness to immunization. Okay, at this point, I'd be happy to take questions.
All right. Thank you, Dr. Gardner. The best laid plans here. I see we have 24 participants. I don't have that many media people listed, so I'm going to go through the list of the names I recognize, and then we'll allow for other people who are in the media who want to ask questions to follow. So we will start with Chris Simon from the Barrie Advance, please.
Thank you very much. Dr. Gardner, one question that's come up to me a couple of times over the past week, so I'm just going to toss it at you. When do you anticipate we will be able to resume close contact? Hearing from some grandparents who are wondering when they're going to be able to hug their grandkids again.
That question comes up very frequently. And in fact, I started raising that question as early as December to the public health measures table, looking towards a day in which we could back away from control measures. And in fact, the Centers for Disease Control in Atlanta has already put out recommendations about the ability to relax control measures based on immunization status. There are basically two approaches you can take when you answer the question. One would be for individuals who are immunized. Another would be collectively for us all as we get an ever greater proportion of our population protected with immunization. And the table is looking at both. But at this point, it's not clear to us. We don't have a definitive answer on that. So undoubtedly, a day will come in which we would be able to reduce these restrictions and have that kind of contact with loved ones again. But it's not clear to us at this point exactly how and when.
Okay. And there's also been some concern, I'm sure you're aware of the AstraZeneca vaccine safety. Is the health unit doing anything, I guess, to monitor locally the safe distribution of that particular vaccine?
So we participate in the province's surveillance for adverse events following immunization. And basically physicians participate in that. Those who immunize participate in that, or their attending physicians. So if any of these individuals encounter a person who's reporting of having an adverse event, they have a particular form they submit to us with the detailed information, and we review that. We submit that to the province, to Public Health Ontario, who uses it, collates it and uses it for overall monitoring of these kinds of impacts and reporting to the public. They've just put out provincial statements to public health indicating that to date the system's in place. They haven't seen evidence of this adverse event associated with AstraZeneca, the other vaccines as well. I think it's a good safety profile to date here. Also, I monitor what Health Canada puts out. So they put out statements indicating that we haven't had the lot that was cited as a possible concern in Europe of that particular type of AstraZeneca. And for another, the overall data, even in Europe, does not actually suggest that there's an increased risk of thrombosis or clotting associated with the AstraZeneca vaccine. There have been some individual cases, but in order to really determine if it's caused by the vaccine, you'd have to see an elevation in the cases compared with the rest of the population, and the data actually doesn't show that. The World Health Organization has also put out a similar statement. So indeed, we need to take this and any other adverse event or the possibility of it very seriously. We need that kind of surveillance system in place to know whether or not there's a real issue or whether it's coincidental. But so far, we're not seeing evidence that there's actually a causal association.
Thank you.
Thank you. We're going to move on to Mark Bruneman from Barrie Today, please. Mark. Are you on mute?
Can you hear me?
Yep.
Yes.
Thank you.
Sorry, I have to switch screens. Can you touch on the testing for the new variants, if the sequencing takes the same time as the one we're calling the UK variant. And also, I'm wondering about how helpful testing wastewater for the two new variants would be.
Thank you for that question, or those questions. So the public health laboratory system in Ontario continues to do this surveillance for variants of concern, and they're actually upgrading their testing methods to be more efficient, quicker, less costly. They're switching from doing genetic sequencing of all of the samples that have come back screen positive to doing a second genetic marker that it can help sort out which variant they're dealing with, so that they can greatly reduce the number of isolates that need to be genetically sequenced. So that's a work in progress. That's very much within their expertise to determine this kind of thing. And for us, we continue to get the data about the variants of concern. Sorry, what was your second question again?
It was about the wastewater testing.
Right. Yeah, so we're getting that data too. That's from both the University of Ottawa and the Ministry of the Environment. What we've seen is some detections of both COVID and, in the case of Barrie, some detection of the B117 variant. It's varied over time since in a month or so that they've been doing this. So we've seen a pattern in Barrie where the B117 variant was detectable when we had more cases, and then some cases fell off after the Roberta Place outbreak. The total case count fell reduced. And so at that point in time, they were not able to detect the B117 variant in the wastewater. And then when our cases started to mount again, they were able to detect it again. So that's been the pattern in Barrie. And then in the other three other communities, Midland and Orillia and Collingwood, that we've been monitoring COVID-19, it's been kind of episodic or sporadic detections.
So what about the possibility of doing those kinds of tests on the two other variants that are now here?
That's a good question. We haven't actually pursued that. We ended up getting the B117 monitoring because the University of Ottawa was interested in doing so, and had offered it as a service and an area of research for themselves. But in my mind, if we're up to over 70% of our cases being the B117 variant or a variant of concern, then it starts to lose its value very much as an agency. We're moving in the direction of assuming that all or most of our cases are variants of concern, and therefore we're focusing on the total case count of COVID-19 itself.
Thank you.
You're welcome.
Thank you. We'll talk to, Dawn Huddlestone from the Huntsville Doppler, please.
Question's already been answered. Thanks, Leslie.
Okay, thank you. We'll move on to Mark Riesler from Moose FM, please, Mark. Matthew.
Thank you. That's okay, Leslie. Hi, Dr. Gardner. Thanks, as always, for doing this. Do you have data on how many people in Simcoe, Muskoka registered to get vaccinated yesterday through the province's portal? So I know they said 94,000 total, but do you have localized data?
I don't have that data, I'm afraid. We will get data on how many people get immunized and who they are, what categories they fall into, but offhand, I don't know. Obviously, my staff would need to know because it's our clinics after all, but I don't have that data on hand. I'll look and see if I can get it.
Oh, I was going to follow up and say, out of curiosity, do you think that will ever be available, localized data? But you just answered my own question there.
Yeah, I think we must have it because they're booking into our clinics, but I'll look into it.
Okay. And now just as we were speaking, or as you were speaking, I should say, during this, I got a press release saying that mobile clinics are coming to Gravenhurst, Muskoka Lakes, Lake of Bays, and Georgian Bay. I know Mayor of Gravenhurst Paul Kelly has been talking a lot since the clinics were announced that he wants a permanent one in Gravenhurst. Is that still a possibility? Is that something that might be coming down the pipe? What's the situation with that?
We have limited resources, and with guidance from an advisory group in Muskoka, chosen the locations we have. We cannot expand to multiple additional locations for permanent clinics because we just don't have the resources to do it. So we're committed to using the other means at our disposal, pop-up clinics, mobile clinics, provision of vaccine to family practices, and the Hammond bus service as a way of achieving equity to access to service with all of those approaches. But at this point in time, we do not believe that we'd be able to set up an additional permanent clinic.
Okay, thank you, Dr. Gardner.
You're welcome.
We're going to move on to Roger Klein from CTV Barrie.
Good afternoon. Can you hear me okay?
Yes.
Yes.
Great. Thank you, Dr. Gardner, for taking questions. You mentioned that we are in a concerning trend, up an increase of 39% week over week. You see that a concern as we head into the long weekend? You mentioned St. Patrick's Day, but we also have Easter long weekend coming up as well, and that's probably more of an event than St. Patrick's Day, I argue. Do you see us moving up from the red zone?
I'm concerned about the trend for sure. I want people to take it to heart that we're headed in the wrong direction right now. That and the variants of concern are on my mind. The potential for a third wave that's been predicted as a possibility is on my mind. So I think it's important that everybody know this and take it to heart and to abide by the public health measures and basically stay at home advice that we have for people, the physical distancing when they're not, and the mask use. Indeed, we'll continue, as we always do, to monitor the data to see what impact happens, what further transmission happens in the days, weeks to come. If in fact you end up with very high numbers, then there is the possibility of going into further restrictions. I certainly don't want that. I've heard from many people in the community that they don't want that. So it really comes back to what are we all going to do collectively to avoid it?
Great, thank you for that. And one follow-up question regarding the different phases of the immunization rollout. When do you see frontline workers in the hospitality industry getting vaccinated? Some people working in that industry see themselves as fairly high risk. They're working with maskless patrons and touching a lot of utensils and things like that. When do you see them kind of coming into the program?
Well, I do believe that people who work directly with the public are at some risk, and also people who work face-to-face with others in work environments. We've seen many outbreaks throughout the pandemic, and certainly throughout the second wave of the pandemic, and now with the variants of concern. And restaurants is an environment in which it can happen, manufacturing, offices, personal service settings. Those are places in which we've had outbreaks before, and that people need to be careful. And I sympathize that they want to be immunized. I think it's a very good thing that they want to be immunized, and it certainly will be very good when we're able to provide it for them. According to the province's vaccination priority groups and sequencing, they would fall in the second phase, later in the second phase, after individuals who have pre-existing medical conditions that put them at risk, and after older individuals working your way in 5-year increments below 80 down to 65 have received immunization. So I do look forward to being able to work with employers and large work settings to be able to provide vaccine. If I anticipate that when we get to that stage, there'll be a number of work environments in which we can work directly with the employers to provide immunization in those settings. And I certainly will do all that I can, all that we can, to make it readily available to workers when that time comes. And I hope that it comes sooner rather than later. That will depend on the supply of vaccine, and the fact that we're able to push off second doses of vaccine to 16 weeks means that we can get to everybody with their first dose sooner. So I look forward to being able to do that, and I hope it happens sooner rather than later.
Thank you.
You're welcome.
Okay, we'll go to Mary Beth Hartle from Muskoka Region.
Well, hello there. I think it's wonderful that you've opened up to family practitioners with family health teams, but as you are probably aware, there's a lot of people that don't have doctors. Mm-hmm. Do you see us opening up to various pharmacies and stuff along the way?
I certainly welcome pharmacies participating in immunization, and there is a pilot happening right now in Toronto, Kingston area, and Windsor, Essex, with a large number of pharmacies that are receiving AstraZeneca vaccine to provide to people 60, 64 years of age. And I would welcome that would go beyond being a pilot to being a provincial program to give people yet another option for receiving vaccine. By the way, that age group might very well change. There was just an advisory report that from the National Advisory Committee on Immunization that was recommending that it be all adults, not limited to those under 65 years of age. So that age group may change as well with that vaccine. So yes, I welcome it for pharmacies, but it's not happening here yet.
Thank you.
You're welcome.
All right. Do we still have James Bowler from Cogeco with us? Okay, we're going to move on then to Mark Claremont from Muskoka.
Hi, Doctor. Do you have any concerns about the drop in the testing of COVID?
Yeah, so thank you for that question. I did inquire about it. One possible explanation is the on-site testing happening at long-term care facilities that would reduce the need for people to get their testing done before they go to a long-term care facility. They formerly had to go to an assessment center, and now with the on-site testing, that would be part of the explanation as to why it's dropped. So with that explanation, I'm less concerned.
Okay. And also regarding those mobile clinics, do you have any pinpoint for the dates? Because people are still concerned about all website booking portals.
So with regards to our mobile capacity, we reach out directly to those premises in order to book them, arrive, and provide vaccines so they don't have to book when we do that.
So you don't really know, is it going to be this? Yeah.
I guess you're asking for detailed information with regards to when we're going where. I don't have that at my fingertips at the moment. I can inquire with my staff to give you more information about that.
And just quickly, finally, is your portal for the booking South Simcoe Muskoka up to date?
Our booking system that we have right now is a pre-registration system for individuals who are in the priority groups that aren't age related. So we've reached out to professional groups, health professionals, in order to invite them to come to our site and book. And then we take their contact information and submit that to the province to include in their system. And then they reach out to those individuals and book them for our clinics.
Fine. Thanks very much.
You're welcome.
Do we have Mandy Webster with us from Rogers today? Okay. The other names I have or numbers I have here are only phone numbers. So phone number ending 6936. Would you like to ask a question? All right. Phone number ending 7304.
Sorry, Leslie, it's Matthew with Moose. I just interrupt. I think you might have to unmute the phones yourself for them to answer questions.
Well, that would be helpful. Thank you, Matthew.
No problem.
No, I can't do that. Perhaps Sonia can. Sonia, any luck unmuting those phone numbers?
The calls want to unmute themselves.
Oh, there we go.
Yeah.
7304, would you like to ask a question of Dr. Gardner? No. All right. Is there anyone else who has a question for Dr. Gardner who has not had a chance to ask one?
Hi, it's Ian from Barrie 360.
Oh, Ian, please go ahead.
Hi, how are Yeah, thank you. Hi, Dr. Gardner. I'm just wondering if you could clarify again. I wasn't clear on it, and we've had some questions asked again. If you don't mind, this the 60 to 64 age bracket will get a contact from family doctor or what have you. Some people have said, I don't have a family doctor. I have to go to, just a clinic on Duckworth Street or the Wellington Street area. How do they manage to get a vaccine if they're without a healthcare provider? What the protocol is and who? Thank you.
Unfortunately, I agree. There are certainly people who don't have as good access to healthcare because they don't have a family physician or a nurse practitioner or primary care practitioner. And this would be an example of that. At this point in time, with this arrangement in our health unit, they wouldn't have access to this particular vaccine. So going forward in time, there'll be other opportunities. We already cited the potential in the future. I anticipate for pharmacies to be participating in this. Our own mass vaccination clinics will work through the priority groups, including younger aged groups, in order to make them a priority to be able to book and come into our clinics. And eventually we'll get to the point where it's open to everybody. And once again, they would be able to book to come to our mass clinics. So I agree at this point in time, they would not have this particular opportunity to receive immunization, but I feel confident that they'll have others.
And one final, doctor, you're aware the Ontario Hospital Association has said we're in the gray zone. Dr. Williams isn't ready to go that far yet. What is your take? I mean, you may have repeated this already locally in terms of not gray zone. I'm sorry, third wave. Are we there yet, or what determines for you that Simcoe Muskoka is in a third wave?
That's a good question. There isn't a firm definition of the onset of a wave. It's something that I think we all just agree to after the fact when it becomes obvious that we've got many more cases that have been mounting over time. So I don't think I'd be able to say for sure that we are beginning a third wave. I am concerned about the possibility because we've actually seen an upswing in cases provincially and starting to see that again locally. But I think it's the kind of thing you could determine once you're into it for a time rather than at the very beginning.
Okay, thank you very much.
You're welcome.
All right, I'll ask one more time if there's anyone who's on the phone or on the Zoom call who would like to ask a question who hasn't had a chance. You can unmute and ask your question and identify yourself. All right, seeing none, Dr. Gardner, thank you very much. And we'll see everyone again next week for the next Zoom meeting.
Bye, everybody.
Thank you, Leslie. Thank you, Dr. Gardner.
Thank you.
My pleasure. Goodbye.